Good afternoon. It's Kevin Kirkpatrick from the Avery Professional Group. Just wanted to come on and do a live stream. Um, there's been a lot of press recently in a couple of the different Canadian provinces, New Brunswick and Newfoundland, specifically. Sorry, most of it has been around their use of travel nurses and the costs that they've been charged. So I thought I would touch base on some of the things I think that can help us get away from this type of stuff and why agencies are used in the first place. So, full disclosure, I own Avery Professional Group, which is a physician and healthcare recruitment firm. I do mostly permanent placements, so it's not travel nursing or things like that. We will do that for clients, usually on a fixed price, where there's an agreed upon margin up front. So if we are going to pay the nurse $100 an hour, then we would bill the client $140. So instances where the nurse is being paid $150 and they're billing $315, that's not really value for dollar, right? And organizations like mine do need to make money to pay for staff and pay for tools. I spend several $1,000s a month just on tools to find contact information and message people in LinkedIn and all those different aspects. So there is a reason to generate income and revenue, providing a service. Obviously, overcharging is a big challenge, right? And that's really overvaluing the service you provide and thinking you deserve more than there. So why do hospitals, long-term care homes and stuff like that use agencies? Well, it starts with this notion that, or the obvious is, these organizations don't have a large recruitment staff, right? Because it is a non-clinical cost, it's often perceived as not a primary thing to spend money on, right? So when I was with Humber, I had 5 recruiters. Each one had between 70 and 100 vacancies. So, that's going to give you a time to fill of, 45 plus days, if not more. And of those, some were internal, so just internal union movement. Others were true external placements. So, sometimes it's a lack of resources because there's not been enough internal applicants because they haven't seen your jobs on Indeed or on LinkedIn or on different nursing associations or physician journals and stuff like that. Sometimes the other reasons you use a recruiting firm is that you might need somebody for a project and for a short term. So, hiring a full-time person only to lay them off in 4, 5, 6 months doesn't make sense. So, in those cases, you can bring them on a contract for the specific time and then have an agreeable end to it. Other things are rigid scheduling. Like hospitals sometimes have to use agencies because their scheduling processes, which are usually collectively bargained, are rigid, and people want to use and want to have schedules that they can live with and they can build their life around, because it's a hard job and you want time off. So, I was actually reading the Nurse Retention Toolkit the Government of Canada and Dr. Lee Chapman put out. And, one of the things they're talking about is flexible scheduling, weekend work, being able to basically allow the nurses the ability that the most of society has to generate, schedules that work for them. The other aspect is agencies do pay more because the nurses are predominantly independent consultants. So there's no hoop pension reductions and stuff like that, because often what happens is a full-time employee, between union dues and pensions and stuff like that, what you take home is actually a lot less than your gross salary, right? So even though you might be making $100,000 a year, you're probably bringing home $4,800 a month. So, it's not as cushy as we would think. So, a lot of the agencies are either flexible scheduling, or the ability to work in multiple places, right? So one of the things that the Nursing Retention Toolkit posted about in their report, and it's a 75-page report, so you mean I've skimmed through it, is things like a provincial pool, right? So nurses can be credentialed provincially and employed and dispersed as well. So often the notion is that we want as few employees as possible because we want to manage our costs. But I think we need to look at the notion of hiring as many nurses as possible and allowing them to work when they want to work. Yes, it creates an additional administrative burden. However, realistically, it's no different a burden than being constantly short because somebody doesn't want to work that specific schedule, whether it's continental or whatever it might be. So having a flexible arrangement means you need more people, but more people may work at multiple hospitals in order to do that, right? So the other piece I think is onboarding, ensuring that we do onboarding and stuff like that. So, the thing I'll move on to now is kind of what can we do, right? Like what can we look at around, improving our internal recruitment process. Well, part of it I think is, allocating the appropriate resources, right? So, a lot of the recruiters I know have over 40 vacancies that they're working on. So let's put that in context. If you have 40 hours a week that you work and you have 40 vacancies, each vacancy can be worked on for 1 hour a week. Knowing that it often takes about 6 times that to fill a position, at least, interviews alone are an hour. If you interview 3 people, you're at 3 hours. So what that means is they're not able to work on other vacancies. And when I was with Humber River Hospital, our recruiters had closer to 70 to 100 vacancies. So some vacancies will not get worked on every week, right? So you imagine a hiring manager who's got a 24/7 schedule and they're not able to fill that schedule or recruit because the recruiter literally just doesn't have enough time, right? I did a survey at one point of public sector recruitment workload, and they were on average of 20 to 25 vacancies. So that would give you 2 hours a week. And now there is the ability to have efficiencies of scale where you're, recruiting for 3 of the same position. So it's duplicated and there's efficiencies there. But in a lot of cases, there's not an efficiency to be done. And hospitals then are stuck with this post and pray mindset where, they can put things on social media, they can put job ads on LinkedIn, on, the RNAO website or wherever it is, but they then have to hope that people see it and hope that that person sees it and it's the right information to engage them enough to respond. Whereas when you reach out to somebody and share information, they can likely respond. And based on how they respond, you can craft your messages based on what objections they might have. So that's a conversation and a back and forth. So it allows you to get to the root of what the problem is, and it allows you to describe it more. Often when we do multi-messaging to candidates, each message has a bit more information than the message before. So by the time we've hit the 3rd message to a candidate, they should know enough to determine whether they're interested or not. And if they're really active, they might reply to the 1st email. But if they're passive, they might respond to the 4th email or a call, right? But when you are dealing with 70 vacancies, 40 hours a week, you do not have the time to sit on LinkedIn and source and reach out to people, let alone do Boolean searches on Google and reach out to people, right? You're not using your phone very often because you will literally be emailing candidates, setting up interviews, and doing all kinds of administrative stuff. So the reason that organizations need recruitment agencies is because we do the outward reach. We do the 5 emails to a candidate to see if they're interested, the phone calls to people we know that might refer their friends, right? So a lot of my work comes from talking to one physician or nurse who then refers their friend. And because I've built a relationship with them, then they will do that, right? So I think some of the core things that we need to do is understand that recruitment in a people driven business like healthcare, recruitment is a prime resource. We need to invest as much as we need to get them to the point where they're at 20 vacancies. That could be separating internal recruitment and transfers with external recruitment, and dividing staff. So you've got HR people doing the internal process, which is much more labor relations process driven. And then you've got recruiters doing the outward recruiting and potentially sources generating names for the recruiters as well. There's no reason we can't create flexible scheduling, right? There are all kinds of Shift Link. There's all kinds of different apps to help manage that, where the nurses can use technology or allied health to pick up shifts. So, if you do your schedule 6 weeks, 8 weeks, 12 weeks in advance, it takes away that perceived variable nature of it. Other things to look at is, career development, right? Retention is key, right? Retention will drive recruitment. Good organizations that have a good culture, the word gets out. So people hear that they've got a good culture, and then they look to those organizations for applicants, right? The number of applicants I got in downtown Toronto hospitals was much different than I got outside of the city, and still is. And, the hot companies or hospitals or clinics or whatever, they get applicants because people search them out. And you have really two key ways of being the organization that people want to come to, right? You pay really well, or you develop really well, right? So either people are coming for you because they want to make money, or they're coming because they want to grow their career. And I think that the notion of growing a career and, allowing someone to invest in themselves and investing in them to ensure that they move forward in your organization is key. So, instead of going to another hospital, become a nurse practitioner, why wouldn't you, invest in their training, allow them to do their practicums in your organization? Or, one of the hospitals I work with was they have a partnership with a college that allows them to deliver the critical care courses, right? So, a nurse in nephrology could choose to take the critical care courses and work in the ICU, right? And then you could upskill into areas that were in need. ORs have historically been hard to recruit for, so you offer the OR course to nurses that are interested. Now the key is, as you put recruitment incentives, you really need to double that and create retention, right? So nobody's going to say no to a signing bonus and stuff like that. But if we only give signing bonuses when we recruit, we're ignoring the existing staff. And taking care of our existing staff and being a staff first organization is what's going to be key, right? Finding ways to ensure that your clinical staff and your corporate staff and administrative staff have the right tools and support to do their job is key. And I think where we've gotten to that point is we often think we're going to recruit our way out of these challenges, where I often think that you really need to focus on creating an environment that attracts people, because then you can take that and market it, right? There's so many different ways to share information, doing LinkedIn Lives, mailing lists, social media posts, interviews. There's so many ways to get the information out that you really need to control the information, right? And when we do outreach to candidates, controlling our messaging is the biggest key, right? There's a million different technologies to allow you to reach out to people, but if the message doesn't resonate, then what happens is you're really not going to get their engagement, right? And engagement is everything, right? And I always often joke that I rather have someone tell me I'm an idiot than say nothing at all. because at least then we can have a conversation about why I'm an idiot, and it either changes my perspective or maybe I change their perspective. The other piece is that depending on what your job postings say, someone may not truly get a full picture of what the job entails. Whereas if you can communicate with them, it will resonate more with them and get greater engagement. So, the main reasons I think agencies are there is to guide you through some of these external processes that you don't have the time to do. And I know when the last hospital I worked at, even with a team of 6, I would have to do sourcing for the recruiters, even though I was the manager, because they didn't have time to source. So if you don't have time to reach out to people and to try and grow your pool, then you're really only dealing with half of the equation, just the people that are going to apply, right? So, and you will get great candidates that apply, and you will do that, but you need to create a fulsome recruitment practice, something that covers off the marketing of the organization and roles, the candidate engagement, hiring manager engagement, and stuff like that, right? So, I've worked at multiple hospitals where we've had to make small tweaks to improve our process, and small tweaks to improve how we handle things. And, the reality is that agencies will never go away while there's a shortage, but we can rely on them less if we increase the resources that we use internally to recruit better, as well as offer what candidates want. Because if candidates can get what they want directly through a hospital, they won't go to an agency. But right now, the agencies are the hustlers, in the sense of they're constantly talking to people. So they are building the bigger network, right? They're building the bigger, broader network than the hospital is themselves, because the hospital's network is solely those that apply, right? So consider this, I do not agree with, charging twice what you're paying the nurse. I believe there are needs for agencies and stuff like that as well. But ideal clients for me use me twice a year. And you help them with that one thing that's maybe outside their norm, right? Like, so somebody will come to me and say, okay, Kev, I need a perfusionist, and it's not something they recruit many of, but I can dig deep enough to find somebody, right? Or somebody's like, you know what, we really need ICU nurses because we're not digging deep enough and getting them ourselves. A lot of it is, hey, I need a specialist in this specific area. It's not an area that we've got a clinic. We need to outreach a bit more. So, there's really the attraction piece of who applies, and managing that process and giving them great opportunities and great feedback, and candidate engagement is key. Then the other piece is the outreach, right? The outward stuff. Like, what are you doing to get your name in front of people that might not be looking at your website, right? Because consider your website is literally one space in a giant universe that if they don't happen to be on it, they won't see your jobs, right? So you have to take that out and put it in front of people across the rest of the universe so that they can see it. So that's kind of my commentary on agencies and stuff like that. I'm happy to discuss things in certain specifics. Geography often affects why people work in different spaces. If you're in a northern community, then travel nurses is probably something that you rely on. But do you need the agency to do that for you, or can you do it yourself, right? And it just comes down to creating structures and processes that support the contract employment, and that allows you to do this. And understand there's labor relations impacts, but if you work with your unions, they should be willing to help you find solutions that don't mean just throwing money at stuff, right? So either way, have a great day. Again, I'm Kevin Kirkpatrick from Avery Professional Group. Happy to talk healthcare recruiting with anybody about anything. You can always reach me at 905-447-2151 or kevin@averyprofessionalgroup.com. And this is now when you respond and say, hey, Kev, you're an idiot, or hey, great post. So I'll take either. Have a great day.